Hello, I'm Lisa Martin from HORIBA Veterinary, and I'm delighted to welcome you to this continuing professional development webinar, the next in our ongoing series. We're very pleased to have you join us today. All of our previous CPD content on a wide range of veterinary subjects is available to watch back at any time in the support section of the HORIBA Veterinary website. Firstly, I'd like to introduce you to our full team of speakers today, tell you what to expect from the webinar and a little bit about HORIBA Veterinary. We're very pleased to be working today with three highly respected professionals with a wealth of experience in practical human and veterinary medicine and care, and in promoting the One Health values in a wide range of environments. The World Health Organization states that One Health is an integrated, unifying approach that aims to sustainably balance and optimise the health of people, animals and ecosystems. Our first presentation will be from Helen Ballantyne on the aspects of One Health related to human healthcare. Helen graduated with a degree in pharmacology in 2002 and qualified as a registered veterinary nurse in 2005. She's worked nationally and internationally in referral medicine and surgery, charity practice and emergency nursing, and along with exotics. In 2013, Helen qualified as a human-centred nurse, and following a stint working in cardiothoracic intensive care, she currently works as a transplant clinical nurse specialist. Day to day, she supports living kidney donors through the process of donation, including an on-call role managing the logistics of all transplant processes. Whilst her primary role is now within the NHS, Helen remains an RVN with a strong interest in the principles of One Health. She's the current chair of the UK One Health Coordination Group, lecturing and writing about concepts and ways of working that may be shared between the professions. She completed a Masters in Healthcare Management in 2021 and is currently looking for her next big project. Our next speaker will be Fergus Allerton, who graduated from the University of Bristol in 2004 and completed a residency in internal medicine at the University of Liège in Belgium. He's a diplomate of the European College of Veterinary Medicine and currently works at Willow's Veterinary Referral Service in the West Midlands. Fergus is actively involved in veterinary antibiotic stewardship and contributed to the development of the Protect Me guidelines. Within the European Network for the Optimisation of Veterinary Antimicrobial Treatment, he's working on recommendations for antibiotic use for surgical prophylaxis. He's the current editor of the BSAVA companion publication and the 10th and 11th editions of the BSAVA formulary. He's also a member of the WSAVA Therapeutic Guidelines Group. Our third presenter will be Simon Doherty. Based at the Institute of Global Food Security, Queen's University Belfast, Simon's interests lie in livestock health and welfare, One Health and sustainability, and international trade and investment in the animal health and veterinary sectors. Prior to his BVA presidency in 2018 to 19, he was Animal Health and Aquaculture Sector Specialist for the Department of International Trade and has experience in veterinary practice, industry, academia and professional representation. Simon was a founding director of VetSustain. He chaired the FVE Fish Med Plus Coalition and the FVE Food Safety and Sustainability Working Group. He was the founding chair of the UK One Health Coordination Group. He recently chaired the BVA Sustainable Aquaculture Working Group and regularly speaks at national and international conferences on One Health and sustainability topics. HORIBA Veterinary sits within HORIBA UK with expertise in scientific testing, mass flow controllers, automotive emissions and air and water quality testing. HORIBA Veterinary and HORIBA Medical are well-established providers of laboratory diagnostic instruments. We work with reference laboratories, educational settings, general practice and referral institutions. Our product range includes handheld meters running single parameter tests, high-capacity automated chemistry and hemostasis systems, and the first fully integrated in-house PCR testing system. Here's a brief overview. Our Aqua Twin handheld meter range works in seconds on individual parameters, including specific instruments for pH, ionised calcium and electrolyte testing. They can all be used patient-side. HORIBA offers benchtop systems for clinical chemistry testing, from occasional use to reference laboratory throughput, alongside immunoassay and blood cast testing. The Pocket Central PCR Analyzer is a unique, easy-to-use benchtop instrument which can enhance your current lab, whichever provider you're currently working with. Now within reach of all veterinary practices, each step of the PCR process is fully automated and can be run by any member of the practice team 24 hours a day. Results are available in under 2 hours, speeding up diagnosis times, aiding prescribing decisions, and improving patient management. The Pocket Central test range includes over 190 assays for bacteria, viruses, parasites and protozoa across small animal, farm, equine, poultry and aquaculture work. With new offers on instrument rental and smaller pack sizes for testing, PCR is now available for all practices. Should you have any questions for today's team, please pop your query into the chat box on the screen and we will cover as many queries as possible at the end of the webinar. If you're watching live and would like HORIBA to issue you with a CPD certificate of attendance, please provide your name and email address into the chat box and we will send this on to you in the next few days. You'll also have our contact details at the end of the webinar for any further queries or if you're watching back. The event recording will shortly be available to view via the HORIBA Veterinary website and you'll be sent details on how to access it for you or for any colleagues. So I'd like to hand over in turn to Helen, Fergus and Simon for their presentations on One Health, Actions in Diagnostics and Therapeutics.
Good evening. Thank you very much indeed for that fantastic introduction and insight into everything that HORIBA can provide. So thank you very much indeed for inviting me this evening to speak on what is probably one of my favourite topics, the human side of One Health. When I was originally asked to speak about this particular topic, it was easy to assume that actually this was simply me addressing the medical side of what is the One Health triad, so the kind of the links between veterinary health, medical health and the environment. But in fact, actually, when I started to look at the topic in a little bit more depth, it turns out that this is a much broader scope, and like lots of things in One Health, you know, the links and the collaborations are fairly evident. And actually what we're talking about in this session from my point of view are actually the real people side of One Health. So we're talking about some very local projects, possibly some more small scale kind of things that are underneath the One Health umbrella, very diverse range of topics. And hopefully what we're going to do is think about what that encompasses, what the benefits of thinking about One Health are, because we all know how busy we are. We've got staffing issues, you know, busyness issues. The teams across both veterinary and medical practice are you know, busier than we've ever been. So it's really important to think about why we should think about One Health. And then most importantly, towards the end, we will just think about a few very simple and quick and easy things that you can do, hopefully when you wake up tomorrow morning and get the kind of One Health ball rolling wherever you work. So what we've got here are just 6 of kind of what I think, excuse me, are some of the main themes of the human side of One Health. Now, this is by no means an exclusive list. It's the beginning of a very big list, but I think some of the most important things and some of the kind of key things that we can cover. So first is the human-animal bond. And I think it's really important to think about how that bond impacts on decision making. And we've got a few examples of how that's used in the NHS and how it's used in One Health as we move forward over the next kind of 15-20 minutes. Medicines management And this isn't just about antimicrobial resistance. While that's a huge topic and one that we need to take very seriously, actually, this is a much broader approach. And this is about ensuring that we have a universal, joined up approach to medicines management. This is about prescribing, handling medicines, knowing about how they should be used, teaching people, and having a united front across healthcare, whether that be through animals or people. Emerging disease. The World Health Organization acknowledges that 70% of emerging disease, so this is disease that is that we're going to have to tackle in the coming years, months, potentially. 70% of those expected diseases are zoonotic. And we know that actually when it comes to zoonosis and it comes to managing new disease profiles, establishing patterns and recognizing patterns is really, really important. And the best way we can do that is by making sure that we're talking to each other, both from the human side and from the veterinary side as well. Client expectation and health literacy is a very succinct sort of example of the kind of concepts that are coming through that we're seeing in the NHS, or actually in this case potentially have seen in the NHS, that indicate the kind of things that are going to, I guess, kind of be part of the veterinary world as we move forward. We know in the NHS, the client expectation, patient expectation is very, very high. I can tell you, I've got an inbox full of emails from people who are, very keen to know what's going on and keen to get updates that actually I physically don't have the time to provide them with, as I'm sure is expressed across the veterinary profession as well. And then there's this increasing health literacy. Now, health literacy is this idea that people are much more informed about what's going on in their lives, both from their health and from their animals' health and well-being as well. And of course, that is rather depends on where they get their source from, and that can be a real hindrance, or in fact, it can be a real problem if they are looking at information that possibly isn't quite as evidence-based and useful. And then we've got the role of veterinary professionals in public health, and that sounds very grand. It can sound a little bit intimidating, but actually this is about thinking about the role of veterinary professionals in the community. So actually this was sort of really pushed to the forefront, I kind of feel, with COVID. So veterinary professionals we all know that veterinary professionals were really kind of part of the pandemic response. There were people that were stepping up and they were volunteering in the NHS, they were vaccinating, that kind of thing. And suddenly the veterinary team was becoming, part of the community and part of the COVID pandemic response. One of the key things I think that from One Health that could be used within this kind of area with that community profile are the social determinants of health. And these are fantastic sources of data that allow you to think about who you're representing in the community, who your clients are, the kind of things that can influence health without being blood pressure, temperature, any of those kind of things. So these are things like where people are living, what they're working, what their jobs are, and understanding that actually healthy pets need healthy owners, and potentially understanding that, if you're in an area where there is an increased level of respiratory disease, for example, things like respiratory disease, COPD and that kind of thing are overrepresented, then it's entirely possible that that will be seen in your veterinary patients as well. Then we've got this element of shared learning. So this is fairly basic, but I think something that's missed fairly frequently. So we've got this increasing acuity of healthcare, and that is established across both veterinary and medical professions. We know that patients are living longer, they're getting sicker, and we need increasingly more complex, areas of healthcare to tackle those. So if there's areas where we can actually share knowledge from the NHS, share knowledge from our medical colleagues, that's really important. And then there's our client demographic and individual support. Again, this is about reaching out to the NHS, having resources available so that they can be used to support clients. Elements like making a clinic potentially a little bit more friendly for patients or for clients with dementia, for example, or having a think about adaptations that can be made for people under the neurodiversity umbrella. There is a huge amount of resources in the NHS, masses and masses of things, both clinical and non-clinical. And actually, I think it's probably a resource that is underused significantly. Certainly from a nursing point of view, when I was in practice full-time, in veterinary nursing practice full-time, it never occurred to me to look up what the human nurses were doing. And, you know, I'm a proper nursing geek. I kind of, you know, I read anything I can get my hands on. But actually, you know, journals such as the Nursing Standard, other journals are available, but I think the Nursing Standards are a really nice overview of things of real contemporary nursing, are potentially a really useful resource for nurses in practice, getting a sense of what's going on kind of in the outside world. And in addition, there's some really, really good resources on non-clinical kind of elements. We're talking leadership, compassion, fatigue, breaking bad news, bereavement, you know, all of these topics that we as veterinary staff are facing on a daily basis. And there's lots and lots of information out there. So it's difficult in the time that we've got to really kind of hunker down on any particular kind of projects that are going on in the NHS. There's a huge amount of things that are happening in the NHS, lots and lots of things that are going on. But actually, I think this kind of experience that I've had in the last month or so probably kind of sums up the situation of One Health that I see in the NHS. Now, the NHS that I work in is a real organisation of contrasts and actually an organisation of extremes. So on as Lisa mentioned in the video, on a day-to-day basis, I'm a transplant coordinator. My role is fairly self-explanatory. It's right there in the title. So I coordinate transplant operations, and this involves potentially within an hour's notice, mobilising an expert surgical team to retrieve the organs of a family's loved one who have made the ultimate gift in allowing those organs to be used for somebody else to move their life forward. Occasionally that involves mobilising planes. It certainly involves mobilising a big team, a theatre and another hospital, all the associated staff that go with that. And that's something that happens 24 hours a day, 7 days a week between kind of me and my colleagues. So you've got that real kind of contemporary dynamic medicine, and on the other kind of scale, I do some nursing work on what is described as a medical ward. And when I first got there, I was quite, I was fine with the medical ward. That's really exciting. Medicine right up my alley. There's going to be a lot of polypharmacy, but that's absolutely fine. The drug rounds are going to take a while. When I got to this ward, it was a ward, 48-bedded ward, and it was full. Obviously, all wards in hospitals are generally full. Full of patients who were described as medically fit for discharge. So none of these patients needed any medical input whatsoever at all. They were just stalled in the hospital because actually what they needed were care packages. They needed family members to be available to come and pick them up, for example. Sometimes it was as basic as that, to be there when they got home. And I found that just an extraordinary kind of contrast in this NHS. And that's replicated when it comes to One Health. So there are some real pockets of fantastic advanced research that's going on across the world when it comes to clinical medicine. But again, I think sometimes some of the human side, the more human side, are happening day to day as well. So this, The Hospital Dog, is a beautiful book written by everyone's favourite Julia Donaldson. It's a story about Dot, who is a Dalmatian who is spends her days very happily swimming in the sea and going to visit patients on Wallaby Ward in her local hospital. But what I thought was really interesting when I read this book for the first time was Julia Donaldson and the author there, Sarah, had made a point of describing how Dot the dog had calmed down a doctor. And they've got it pretty good here. We've got the doctor's shoes, the doctor's chinos, we've got the stethoscope in situ, big coffee on the side, and big piles of paper that follow doctors wherever they go, even when you're working in a paperless environment. And I have certainly experienced that myself. I've been on a busy high dependency unit and felt, the tension just dissipate when the PAT dog arrives. And that's both for the patient and for the staff. Since COVID, we've been, generally the NHS has been really kind of proactive at trying to think about how staff can be supported within the NHS framework. And as you can see here, at one of the hospitals I work at, we now have pets as therapy sessions for the staff. Now that will not have been a benign thing to put in place. That will be hefty. It will have involved meetings and emails and permissions. You can see here on the side that the Royal College of Nursing has some clinical guidelines for dogs in the healthcare setting. The Royal College of Nursing that you'll have heard about most recently, of course, will be associated with unions and strikes, but actually they have, unusually, they have a professional arm as well. And as such, they write and generate a huge amount of clinical resource. And bearing in mind, the Royal College of Nursing covers every element of nursing. So learning disability nursing, adult nursing, children's nursing, you know, everything you can possibly think of, and all the specialities that come underneath that. So oncology, hepatology, immunology, the skin, anything you can think of. This clinical resource, and I spoke to people who contributed to it and wrote it, this clinical resource created more opinion, created more email traffic, created more discussion than any other clinical resource they had put together. It also took the longest for everybody to decide on when it came to content. So actually having pets as therapy within a hospital environment for staff would have needed somebody who was really kind of, you know, dynamic, contemporary, and really open to the benefit, and really kind of, they might not have known it, but actually they will really be kind of approaching things in a real One Health kind of way. And then a couple of weeks ago, I had an experience which demonstrated the other end of the scale. And I walked into one of the transplant offices and was immediately kind of faced with my hepatology colleagues, who were discussing the fact that one of their transplant patients, one of their patients who were sitting on the liver transplant waiting list, had turned down the option of a liver the night before because he had nobody to look after his 15-year-old cats. 2 cats, 15 years old, lived with them since they were kittens. And he said, I'm really sorry, but actually I've got no one to look after them. I cannot come in and have this operation. And the reaction to this was so extreme that in fact the consultant involved went so far as to suggest that his registrar, who had clerked the patient, may well have missed a hepatic associated encephalopathy, because surely the fact that this patient had turned down this offer because of 2 cats must have been a pathological, physical damage problem that made him do that. And of course the team turned on me. You've got the background, what do you think about this? And I pointed out quite gently and nicely that it wouldn't surprise me that if there were some people on the transplant waiting list who would consider their cats, their pets, as important as their children, and that actually perhaps suggesting that they put a couple of bowls of food down and shut the door perhaps wasn't the most constructive way of dealing with this particular problem. So I think that to me, even though we don't really have the time to go into very specific projects, that demonstrates that's my idea of kind of demonstrating we've got these real extremes, we've got these incredible projects, you know, some really engaged, dynamic people involved with One Health in the NHS, and then we've also got, you know, a little bit of work to be done as well. So like I touched on a little bit in the introduction, it's really important to think about the benefits of thinking about One Health. You know, because we're busy, the last thing we want to do is wake up tomorrow and head to your team and say, right, guys, this is what we need to do. I'm giving you some more things to put on your to-do list. But actually, we need to think about the fact that we know that clinical outcomes can be improved by a collaborative approach. Wound management is a really nice example, both in small animal medicine, and there's a fantastic amount of information about a vet who works with rhinos out in the world and has used out in the wild, and has used a huge amount of information and actually has had people visit from the military side of kind of healthcare, so who are very experienced, unfortunately, dealing with very traumatic wounds. And this vet is out there dealing with the wounds that are left by poachers, and so has used their expertise, and they've had this fantastic crossover. It would be very easy to assume that the crossover is all one way, that the vets are constantly learning from people, from medics, but that's not necessarily true. There's some fantastic project work going on in the States in paediatric oncology, specifically in paediatric osteosarcoma, where trials for immunological therapies are being tested, and the entire trial is being modelled on treatments that have been used in canine osteosarcoma. There is the potential here for a massive amount of job satisfaction. You know, it'd be amazing to see a One Health lead nurse in every practice, in every big kind of practice. And even if this nurse is charged with, you know, initially thinking about AMR, actually beginning to have that approach is a fantastic project for somebody. You've got an experienced nurse who's looking for something to get their teeth into, perhaps wants to do a bit of research but don't quite know where to start. You know, you've got a nursing team at the moment who are, you know, really kind of hungry for more potentially when they've got the time. You know, so this One Health is a fantastic potential for that. The other thing is thinking about practice strategy and finance. So this is about client footfall. And this is about the fact that if you make the health of your clients a priority as well within the scope of practice, accept that they have needs, they are likely to have higher levels of health literacy, and anticipate those needs rather than feeling kind of defensive if they're coming at you with questions about, you know, things that they want to know, then actually, you know, these patients, these clients are going to feel more bonded to the practice. Community projects, you know, getting members of staff out into the antenatal clinics to speak to people about how they're going to manage, you know, a new baby and their existing pet. All of these things, I know they're challenging sometimes to organise and they're challenging to release staff for, but actually they are part of a bigger, wider strategy and bonding of clients to a practice. And on a very basic level, One Health has a fantastic marketing potential, you know, social media, old-fashioned kind of marketing, TV, newspapers, all that kind of stuff, you know, love the kind of One Health idea. And even just as a little test, when I was writing these slides I was going to say a couple of days ago, you know, that gave the cat out of the bag. I popped downstairs, turned the Sky on, and, you know, there were 7 channels that were covering at that very time, 3 o'clock in the afternoon, that were covering either veterinary medicine or human medicine. You know, it's really something that lots of people are interested in. And then finally, just something that I kind of feel has got the potential, I'm not quite sure if it's ever been tested, but actually there's the potential for One Health to really help with staff wellbeing. Staff are then empowered to act rather than just to worry. So if we all think about some of the more traumatic situations we've been through in our practice, it's entirely possible that those situations were just as attributable to the patient, the person involved, as they were to the animal. And I can think of sitting with a woman whose Labrador was dying and finding out that the reason she was physically and emotionally on the floor, I can still remember the poor woman howling, was because the dog had belonged to her son and her son had been killed in a car accident 2 days previously. And I mean, that woman haunted me for a long time because I wasn't quite sure what I could have done. But perhaps if collaborations were in place, there were networks available, you know, I could have done something. And again, it's not about reaching outside of your scope of practice. It's about signposting. It's about thinking about the bigger picture. And then finally, my last slide, this is thinking about 3 very basic things that you can do. So 3 main tools of One Health. So we've got signposting, and this can be very passive. This can be a notice board that talks about smoking cessation, for example, and the impact of smoking on animals and pets. Or it can be reactive. It can be about bringing somebody into the practice or bringing resources into the practice so that, you know, if you get the sense that you've got an animal that's in a smoky environment and experiencing passive smoking, you can offer that literature. Using a mutual interest to raise a point, really kind of useful in human practice, but actually, you know, just as useful in veterinary practice as well. This is about, you know, thinking about blood pressure, diabetes care in animals and linking it through to the human side as well. You know, if you're having a client evening about diabetic animals, diabetic cats, you know, ask the diabetic specialist nurses in your local practice to come along and think about, you know, the kind of things that human practice do with pre-diabetes and lifestyle and that kind of thing. And then finally, networking and collaboration. And this is about liaison. This is about sending an email, perhaps, you know, having a conversation, perhaps even spending time with a human-centered team, which is fantastic CPD, free, you know. And the critical thing is that it starts a connection. It starts a professional connection that potentially could help in a difficult case. It could help if you needed some help for one of your clients, but it could also be the connection that prevents the next pandemic, because One Health really is that important. And so that's my introduction to the human side of One Health, and I'll be passing over to Fergus for his insight. Thank you.
Hi, thanks for that, Helen. Really interesting start. And hopefully now you'll be able to see and get a veterinary perspective, and in particular a perspective about small animals, because I'm a small animal vet, and for the last 13 years now, I've worked exclusively with cats and dogs. And what I'd like to talk about is really focus on antibiotic stewardship. This has been a passion of mine for the last 5-6 years, and I think there's so much that we can do as a profession to contribute to optimizing our antimicrobial use. And in doing so, I think that will have so many knock-on effects. The fact that if your vet refuses to give you antibiotics for your pet, maybe when you go and demand them from your doctor for a cough, you'll think twice and you'll say, well, I understand we're protecting these antibiotics to keep them working so that they will be available when they're really needed and not in maybe more frivolous situations. And I think that there's a lot of work going on in all medical professions to try and optimize antibiotic use and to try and drive it down, to make sure that we're using antibiotics when they're really needed. And I'd love to say that we were making more of an impact in veterinary, but I think this graph shows really that we've still got quite a bit of work to do. The metrics that we use, the defined daily dose per vet per animal, are a little bit complicated, but I think we can accept that they're a surrogate for the amount of antibiotic going into our canine in yellow and feline patients in green. And we can see that over the last 5, 6, 7 years, we haven't really made much headway in bringing those volumes, those quantities down significantly. And this data comes from the Veterinary Medicines Directorate. So what can we do? How can we improve that use? Well, I think we need to look at some of those conditions where maybe antibiotics aren't essential, because this happens on a regular basis in both human and veterinary medicine, that you will be presented with a case that it's worrying for the owner. The pet may be vomiting frequently and has been for a few hours. It may have had diarrhea for the last couple of days that's making a mess of the carpet. These things will upset owners, quite understandably. They're worried and they look to us for solutions. And unfortunately, often there aren't better solutions than just supporting that animal and allowing them to recover within a few days from those processes. And so to demonstrate that we're doing something, to feel that we are helping that recovery process, we may reach for antibiotics. And data from animal health surveillance networks such as SAVSNet show that 20% of dogs presenting with acute vomiting are prescribed antibiotics. 50% of those presenting with acute diarrhea are prescribed antibiotics. And often the trigger there is going to be the presence of blood. But it shouldn't be. It shouldn't worry us. If the animal is systemically well, if we're treating it as an outpatient, there's no need in any situation for antibiotics. It's only if that animal is really poorly, we're worried that they're septic, and we're hospitalizing them for all sorts of additional supportive care, that antibiotics may be necessary. But that's going to represent less than 1% of those acute diarrhea presentations. It shouldn't be anywhere near the volumes. And remember, this is one of the top 10 reasons that we see animals in our practice. Cough and itchy skin are another good examples of overprescription, and cough is probably the number one in people. We all go to the doctor as soon as we've got a bit of upper respiratory tract, and we're assuming that it's bacterial, and it very rarely is. So doctors are increasingly trying to turn us back and say you don't need antibiotics. And a few years ago, 2018 this was, we developed the Protect Me guidelines. These are trying to provide vets with recommendations as to when antibiotics aren't necessary. So lots of those conditions I've mentioned, you could say, well, actually, we can manage without. You will get better without antibiotic prescription. And situations where that may not be the case, so that we can hopefully optimize that antibiotic selection, the duration of antibiotic use, the dosing. So there are all sorts of guidelines available. We are redoing the Protect Me poster. Watch out for that coming out and being launched again later this year around World AMR Awareness Week. And we know that that's the UK version, but there are quite a few others available across Europe. And we identified about 15 different guidelines in all sorts of different languages, in Italian, in Turkish, in Norwegian, some amazing ones from Denmark, the Gram book. These all are brilliant tools and worth checking up and taking the best bits from them, because what's reassuring is that they have a consistent message. So whichever language they're written in, they discourage the use of antibiotics for acute diarrhea, for clean elective surgical procedures, for FLUTD, for subclinical bacteria. They highlight the importance of other measures that we should be taking to reduce our reliance on antibiotics. We could be sending off cultures, trying to identify the causative microorganism, prove that we need to be using antibiotics. There are certain antibiotics, the likes of vancomycin or carbapenems, that, and this is there's an ethical consideration here, but I would argue that we should really leave those to our human medical colleagues and say those are antibiotics that are brought out only for life-threatening situations, and we shouldn't be turning to those in cats and dogs. I just wanted to flag one other guideline tool, because this has been came online late last year, and it's produced by the Ontario Veterinary College. It's the First Line app, and for those who complain that the poster is hidden away in a filing cabinet somewhere, it's not accessible when they need it, this is something that you could have on your phone, in your pocket, readily accessible when you need it. It does have a slight North American bias, so there are some medications that maybe we won't have access to quite as frequently as they do, but it offers some tremendous recommendations geared per body system, and it allows you to decide which treatment to give, how long to give it for, and really to highlight areas where you can get away without using antibiotics. And all of these are examples of enablement stewardship. They're things where people have offered recommendations suggesting ways that we can minimize and optimize our antibiotic use. But unfortunately, recommendations can be ignored. And if we want to retain that prescriber autonomy, that right to say to an owner, your dog's got a serious bacterial infection and I'm going to want to treat it with antibiotics, and the best antibiotic for this particular condition, one that's going to penetrate the site, reach the site where it's supposed to, is going to be a fluoroquinolone. If you want to have that right in the future to be able to reach for whichever antibiotic is the right antibiotic for the animals we're trying to treat, we need to demonstrate that we can do it in a rational and sensible way. Because the alternative is that those antibiotics will be taken away from us, and we will be told that while that may have been an effective treatment for that particular animal, that's no longer available. And already in certain countries in Scandinavia, there are antibiotics that are banned for use in even in companion animals, and in countries like France and Germany and quite a few others actually, they now, if you wish to use a fluoroquinolone or a third generation cephalosporin, what are classed as the highest priority critically important antibiotics, you can only do so if you have a supportive culture result and a susceptibility test that tells you that you couldn't get away with something else. So I think we do need to, as a profession, demonstrate that we can use antibiotics wisely and rationally so that we can have that armory available to us to offer the best care, the best welfare to the animals we're trying to treat. And I think when we ask vets, why did you use antibiotics to treat that particular animal, with that dog with diarrhea, acute diarrhea, they will say, well, I wasn't sure why the dog had diarrhea, and what if it had something more serious? What if that had become septic within the next couple of days and my non-treatment had contributed to a deterioration? So they can have that worry that it may get worse and feel that antibiotics offer a safety blanket. We need to be able to reassure vets that their outcome for those patients will be the same. And research is ongoing to demonstrate that non-inferiority of the no antibiotic approach. We need also to combat perceived pressure from owners, because often vets feel that they've got to do something, they've got to provide some pills to justify the fees associated with animal care. And when you ask vets why they did it, they might say it was the owner, they put me under pressure. But if you ask those very same owners, they'll point the fingers straight back at the vets. So I don't think it's necessarily a real pressure. I think it's a perceived pressure, and it's one that maybe we should try and find better ways to address. And this is where communication comes into its own. It's really what we've got to focus on. How can we express to the owner that it's not that we've forgotten that antibiotics exist. It's not that, unlike our previous colleagues, we are unwilling to use them. We are making a conscious decision that they are not the right treatment for your dog. And so we generated in 2018 a non-prescription form, and this is a substitute for your antibiotic prescription. And what we're saying is that we have made a decision. We've based that on the clinical history provided. We've based it on a thorough physical examination, and we think that actually your pet will get better without antibiotics, and the antibiotics could even be detrimental to their recovery. You can offer alternative treatment approaches, so feeding a bland diet, optimizing water intake, those type of things. And there's always that safety netting advice included in the form, so that people can keep an eye on their pets, and if there is clinical deterioration or if they fail to improve in a timely manner, then that decision whether or not to prescribe antibiotics can be reviewed. So it's not a you'll never have antibiotics, it's you don't need them right now. And we hope that the non-prescription form can form part of a conversation and help close out those consultations effectively, rapidly, and without recourse to antibiotics. And this is something that we've stolen, quite straightforward. We've stolen it from human medicine because we know it works, and they've got similar tools that they've been using for some time. And this is a Cochrane meta-analysis where they've looked at evidence to see if non-prescription forms work. In human medicine, they've actually got three options. They could give out antibiotics, that's immediate prescription. They could give out a non-prescription form like we've got, but they could also give out a delayed prescription form that says, if you're not better by Monday, then you can go and see your vet and you can collect the antibiotics. Now, the most important thing to show is that those studies found no difference in patient outcome, whether they were given antibiotics immediately, whether they had a delayed or a non-prescription form. So don't feel you're shortchanging your patients by using these tools, because that isn't the case. There is a question mark over patient satisfaction. Sometimes people feel, well, I've got to come back to the vet to go through this consultation period process again to get my antibiotics. So you have to talk them through that and reassure them that it's a risk worth taking, because the potential gain is substantial. If you don't use antibiotics in these situations, it's going to bring your antibiotic use down and help reduce that key driver of antimicrobial resistance. And I think that there's lots of other things that we can do to support and educate our pet owners. I think that increasingly they are, as Helen said, there's a degree of literacy that's coming, health literacy, and owners have heard these messages when they've been to the doctor, when they've been to the dentist, even during advert breaks in I'm a Celebrity, where they see the dancing antibiotics, encouraging people to keep antibiotics working by not requesting antibiotics from their doctor and by following their doctor's advice. Well, we wanted to do something similar, and so we have produced a little video. This is a short animation. It takes just under 2 minutes. And we offered this, or showed this, to pet owners while they were waiting in the waiting room. And we then performed a survey, and we compared the results of this survey to those who'd seen the video and those who hadn't seen the video. And we found that the video was able to move owners' opinions ever so slightly, but in the right direction from an antimicrobial stewardship perspective. So this video is effective. I'm not going to show it all, but I just thought I'd put up and allow it to run for a moment or two. And hopefully you can see that it summarizes a short scenario where someone presents their dog with acute diarrhea, and the vet's trying to explain why antibiotics may not be the solution in this case. And I think that we will recognize this message, and hopefully we can use that tool, and that tool is freely available. I think we'll share the website, the link where you can access this. It's actually available in over 20 languages. So if people have a multilinguistic client base, then by all means download it in whichever languages are most appropriate, because we want to make this accessible. We want to make sure that people can use it to try and hopefully address that client pressure perception even before it comes into the consulting room, so that if owners are already starting to think about that, starting to wonder, well, maybe my dog doesn't need antibiotics in this situation, it should make for an easier consultation, an easier conversation when those decisions come around. And I just wanted to finish on one final, very much a One Health message. This is an initiative that was launched by NHS Midlands. It was first run in 2021, and last year, as vets, we jumped on the bandwagon. But it's to do with the management and safe disposal of leftover antibiotics. So a survey had shown that of 500 UK patients, a good percentage, up to sort of 1 in 6, had leftover antibiotics. But of those, very few return them to the pharmacy for safe disposal, with most, or a third, throwing them away and a third keeping them for reuse. And both of those options represent significant damage, because you could either contribute to environmental pollution and driving up antimicrobial resistance in the environment, or you might end up reusing them inappropriately in yourself, in another person, or in another pet. And I think that will slow achieving a diagnosis. It can cause unanticipated side effects, and it will also contribute to antimicrobial resistance. So we wanted to improve the way that things were going. So in 2022, veterinary practice teamed up with NHS Midlands, and this really captured the imagination of lots of the veterinary profession from across the country. And what we were doing is encouraging patients to take their own human antibiotics back to their local pharmacy, and any pet owners to return their unused antibiotics back to the vet practice for safe disposal. And as I say, we had engagement from all the major corporates, from the likes of BSAVA, BVA, NOAA, the Bella Moss Foundation, the VMD, and it really did work very well, not just in retrieving antibiotics, because we got over 750 antibiotic tablets back, and various other combinations of different antibiotic products. And some of these were quite important, highest priority, critically important antibiotics. But for me, one of the main gains of this whole initiative was the opportunity to have more conversations about AMR. If we're asking for owners to return unused antibiotics, there must be a reason for that. And it gives you an in to then say, yeah, antimicrobial resistance is important. It could have a detrimental effect on your patient, your pet in the future, but as important, it could have a detrimental effect on your own health in the future because of that shared ecosystem that we live in. And we were able to get this out into various veterinary publications. We wrote to Nature Medicine and published this earlier this year, really demonstrating that through collaboration between the human side from the NHS and the veterinary side, we could pull together to try and raise public awareness about this important issue. So we do hope to do more this year, and the 2023 version is growing and building. We've started earlier, we've been having monthly meetings, and we really want to broaden our involvement this year. So there is an opportunity for people to get involved in this. We want to go global. We want to involve different species, horses, potentially exotics. It's going to be challenging in the farm sphere, but I think that where possible, these conversations are important, and where appropriate, safe disposal of antibiotics needs to be encouraged. And it's an easy initiative to be involved in. So if you're in practice, we would really encourage you to get involved. It's just a matter of raising awareness. We're going to run this throughout November because that encompasses World AMR Awareness Week, and you just need to put up a poster so that your clients can be made aware of it, talk to them and encourage them to return their antibiotics. And we've made lots of assets, so to make this as easy as possible, you can go on to Ruma's website, Ruma Companion Animal Equine branch of Ruma. You can go onto the RCVS knowledge pages, and both of those will offer access to these very good resources. There's an animation that you can put up, there's the posters, stickers, logos that you can put on your veterinary newsletters and things like that. So we really would encourage people to get involved in the amnesty and take part. So just to summarize, I think that from a companion animal perspective, we are trying very, very hard to contribute to this One Health issue. And the way that we're doing that is through encouraging prescribers to make the best decisions for their pets. And we've got various tools to do that, including the Protect Me poster. We're very proud of the antibiotic amnesty and the veterinary component of that, and would really encourage all practices to get involved where possible. It's low input, high output. So really do try and contribute to that and get involved. Log in, signal your register your interest with Ruma, and we can hopefully get some assets out to you so that you can participate. We have the owner education program, and that little animation is freely available to anyone that would want it. We've got those non-prescription forms. Again, try them out, see if they do help you to close out those consultations most effectively. And finally, if you've got 5 minutes, there's a little QR code there, which is a discrete choice experiment that we're currently running with some researchers out of the University of Oxford, just to try and establish a couple of breakpoints at which what drives our antibiotic prescription. And so if you've got time, 5 minutes on that survey would be greatly appreciated. So thank you very much for your attention. And with that, I'm going to pass over to Simon for the next talk.
Okay, good evening, folks, and I'm just going to get the presentation up and running here. So hopefully you can see that. So yes, in this next 15 or 20 minutes, I'm going to cover off One Agriculture, and I guess really what we're doing here is taking the One Health theme a bit further. It's funny, I do quite a few sort of presentations and talks on One Health and sustainability, but every time I come along, I find myself learning from other speakers, and I guess that again just sort of fits with the whole One Health model. So it's been really interesting listening to Helen and Fergus's take on things this evening. So yeah, I'm going to cover off One Agriculture, look, I think we can probably all agree that our understanding of One Health starts with those interactions between people, animals, plants, and their shared environment. And I noticed actually that Helen had the one of the little profiles up, the Virchow quote. But this kind of concept has been around for a very long time. So Hippocrates made that link. If you want to learn about the health of a population, look at the air they breathe, the water they drink, and the places they live. So already you're seeing that interaction, between people, their health, and the environment. Pasteur very much kind of linked veterinary medicine and human medicine, sort of through some of his work. So long before rabies was characterized as a virus and anything was known about that, Pasteur had taken some desiccated nerve tissue that he had passaged the rabies through some rabbits. He'd taken some desiccated nerve tissue and gave that to a young boy who had been bitten by a rabid dog, and prevented the kid from having from contracting rabies. So that kind of link between the pathology within the dog and the potential pathology that the child could have suffered from was there. So very early sort of look at one medicine. Here's the Virchow quote. So between animal and human medicine, there are no dividing lines, nor should there be. This is a guy who, a couple of hundred years ago was well over sort of 150 years ago, was looking at the links, around embolism and thrombus formation, and he was characterizing the need for systemic autopsies. But from a veterinary public health perspective, he was one of the first to recognize trichinella transmission and the need for meat hygiene in that particular sector. And jump forward then to Calvin Schwab. So Calvin was the guy who really sort of first coined the phrase one medicine. Calvin had a joint appointment. He's an epidemiologist. He had a joint appointment at University of California, Davis, in both the medical and in the veterinary school there. And I suppose this sort of seminal text, Veterinary Medicine and Human Health, was what made him sort of stand out as one of the first people to look at one medicine. So this is I suppose, probably the most popular definition of One Health. And I think out of that, the very last bit we sort of take for granted, yes, people, animals, plants, their shared environment. And I think it's useful just to sort of think the environment, we always sort of think of as being the broader environment, but the environment, as Helen talked about, could be the ward in a hospital. It could be the domestic environment in relation to passive smoking of pets. So it doesn't just have to be the sort of environment outside, as in fields and trees and countryside that we're talking about. But within this definition, the really core bit, and you'll have heard it through Helen and Fergus's presentations as well, is this collaborative piece, and it's the multi-sectoral and transdisciplinary approach. So what we're talking about here is, certainly in terms of agriculture, it's not farmers solving all the problems by themselves. It's not even vets working with farmers solving all the problems, but it's looking at where there are opportunities then to commit to collaboration with other stakeholders that are part of the system as well. I quite often use the analogy, I drive a car, but I don't know everything about driving a car. I rely on the engineers to design the car. I rely on manufacturing processes to manufacture the car and manufacture the parts for the car. I rely on my mechanic to help me keep my car on the road. I use a large international company to put fuel in the car. I liaise with government whenever I need to tax it and MOT it. And very occasionally I wash it or take it to a car wash. So again, a small, maybe owner managed business. So we're working with all these different stakeholders to keep a car on the road. It's very, very similar when we're thinking about One Health and the approach that we're taking. The other important part of this definition is local, regional, national, and global levels. Again, some people quite often think about One Health as sort of being this kind of slightly ethereal, slightly fluffy concept that is, away beyond the realms of, the sort of single farm, single unit, or even a private veterinary practice. But it is all those different levels. It goes right from the farm right up to what we're doing at national and international level as well. So let's swap out One Health and pop in One Agriculture, and all of those same sort of principles still apply. Thinking about all those different levels, thinking about the interconnectedness between people, animals, plants, and their shared environment, and what that actually then looks like in the agricultural setting. So if we jump back about 10 years, BVA and the Royal College of Veterinary Surgeons were working on the Vet Futures strategy. So what the veterinary profession might look like by 2030. And out of that, we then created a 5-year action plan. And a couple of the actions then that came out of that were the formation of the BVA Animal Welfare Strategy and the formation of the One Health Coordination Group, which I was involved in founding, and then more recently Helen has chaired that, and we created the One Health in Action report, which helped us to, I suppose, give people ideas of what One Health meant and how that sort of collaboration really worked in real life. The reason I popped up just the piece around the animal welfare strategy, if we jump back to this definition, it says optimal health and well-being. Now, sometimes it is useful for us to pull apart health and welfare, or well-being almost being a function of health and welfare together. Sometimes it's useful to pull those concepts apart into One Health and One Welfare. But generally, when we're talking about One Health, we're talking about health and welfare. So it is useful in the veterinary context to be thinking about the health and welfare of vets and farmers and other stakeholders we're working with, as well as the animals that we're working with as well. So yeah, the UK One Health Coordination Group, we pulled together sort of down the left-hand side, you can see I suppose the human medical bodies. Down the right-hand side, you can see the sort of environmental organisations that we had involved. And along the bottom then sort of more of the veterinary part of the equation as well. I'm absolutely delighted to say, I mean, Helen's had a cracking term as chair, but I think we're all delighted. We've got the Royal Society of Medicine very engaged, and they're going to be taking over both the Secretariat and the chair of the One Health Coordination Group. So it'll be fantastic to have the sort of human aspect sort of really helping to lead on this. One of the questions I sometimes get asked is, One Health, yeah, vets and vet nurses and the veterinary community, animal health community understand One Health. Are the human medical profession maybe a bit further behind? I think it's probably fair to say that, you know, we've had the opportunity to focus on lots of different species throughout our careers. The human medics only focus on one species, and you know, and tend to be quite specialized. So we're probably a bit more used to collaborating in a sort of broader sense than maybe the human medics are. But I don't want to sound like I'm making excuses. It's fantastic that we've got some of the medics now really kind of coming on board with this, and as I say, you've heard already of some really good examples of that. So the One Health in Action report pulls apart these sort of 6 key themes. Again, a lot of people think of, you know, give me an example of something that's to do with One Health, and they think of AMR. You know, again, Helen and Fergus have touched on some of this already in terms of the AMR, zoonotic diseases, but also then the sort of mental health and well-being, non-communicable diseases, the effect on the environment and climate change, and then injuries as part of that as well. I'd encourage you, if you haven't already looked, download that One Health report and have a look, because it contains some really nice case studies to help understand what One Health in Action is all about. One Health and sustainability are almost inextricably linked. You know, I almost kind of talk about sustainability as sort of being this end goal, a sort of Zen, sort of where everything's in balance. And One Health is part of the journey to getting towards sustainability. So we need to do that collaboration and communication in order to reach sustainability. But there are a bunch of us who are involved in setting up Vet Sustain. And you can see here the 6 veterinary sustainability goals: good life for animals, health and happiness, clean water for all, no waste society, net zero warming, and diverse and abundant wildlife. And ultimately, we want our veterinary practice in the broadest sense, whether we're in research, pharmaceuticals, feed industry, general practice, farm animal practice, equine, small animals. We want to be doing the best that we possibly can to try and achieve these sustainability goals. So AMR, I'm not going to dwell too much on this because you've heard quite a bit from Fergus already about on the small animal side. But a report out today from WOA, the World Organization for Animal Health, used to be the OIE, has announced a 13% reduction globally in antimicrobial usage. Quite often, it's, you know, we focus on the UK, but clearly things like AMR are global issues, and we need to be encouraging best practice across the globe where we possibly can. And that element of trans, you know, continental and international collaboration is where that then becomes increasingly important. It's all very well us reducing antimicrobial usage in the UK, but actually we want to then take that further. Fleming is, you know, antimicrobial resistance has been along. You know, Fleming was awarded the Nobel Prize for discovering the therapeutic use of penicillin, but in his acceptance speech, his Nobel acceptance speech, he was recognizing even at that stage that resistance was at least a possibility, and we needed to be very careful with our stewardship of antibiotics. 15, 20 years ago, there was a lot of mudslinging, you know, and the human medical profession were blaming the farmers and the vets for, you know, bucket chemistry when it came to the use of antibiotics. And equally well, I suppose, you know, we could have stood accused for saying that, well, you know, it's the GPs that are handing out antibiotics like Smarties, that is the problem. And I think through One Health approach and that communication and collaboration, there's a bit more common ground. So Dame Sally, you know, who would have been quite outspoken in the past about farming and veterinary community, even sort of more recently has recognised that in the UK, we believe that the major drivers of resistance is prescribing for humans. Nevertheless, we appreciate that good farm management, biosecurity and animal husbandry systems are vital to minimise the occurrence of disease and therefore reduce the need for antibiotic usage. But it's interesting that she picks out farm management, biosecurity and husbandry systems. You know, that's really critical, again, because it's not just about the farmer and the vet, but it's about agricultural engineers. It's about people that are, you know, making disinfectants and you know, how we go about practicing biosecurity and our farm management, as well as things like, you know, ventilation to reduce pneumonia, reducing stocking densities to reduce the transmission of bacterial diseases in young animals and things like that. But clearly these are all really, really important components of thinking about antibiotic usage in farm animals. O'Neill, and again, I included this slide because again, it sort of helps to focus our minds on other disciplines that are involved. The pharmaceutical sector, who are developing new drugs, vaccines and alternatives. We've got companies like HORIBA that are working in diagnostics and the importance of developing new diagnostic tools that can help us to reduce, refine and replace antibiotic usage. And that these obviously go across both human and veterinary medicine. All of that needs sufficient funding in order to sustain that innovation. And therefore you need to have investors who are looking at that as well. So the financial sector have a really important role to play. International collaboration, and you heard described in my bio, I previously did some work with the Department for International Trade, and that was about helping to share UK knowledge in that space in other countries. But you can see there that there's a whole range of different disciplines are involved just in this kind of idea around tackling drug-resistant infections globally. It's really important that we use the right kind of language. So always focusing on resistance can be a problem. So therefore we want to turn this round into a positive story and talk about antimicrobial stewardship or antibiotic stewardship. In other words, how to do things right or do things the best that we possibly can. And Fergus has eloquently described some of the ways that we're refining our use of antibiotics and replacing it and reducing them in both companion animal medicine and that equally applies across into farm animal medicine. So we're not always just reaching for the bottle of fluoroquinolone. We're thinking about what the specific problems are. The third and fourth generation cephalosporins, we're trying to reduce the usage of those sort of top shelf antibiotics down a bit. So BVA has produced some tools again to help with that. So the sustainable animal agriculture position contains elements relating to both welfare, but also then things like herd health planning, routine visits, and biosecurity arrangements on how we benchmark and reduce antibiotic usage. I included the photo of the dung beetles here, just I suppose a quick reminder. One Health, and when we're thinking about antimicrobial usage, it's not just antibiotics, it's anthelmintics as well. And certainly, dung beetles are really important in terms of utilizing the nutrients from farmyard manure and from slurry out on pasture. Dung beetles are really important about, for getting those nutrients back into the soil again, for onward grass growth. But if we blanket treat everything with ivermectins, then we'll kill the dung beetles as well as the worms and the ectoparasites on the livestock. So we want to be thinking about that as well, whenever we're thinking about the sustainable use of antimicrobials. I talked then about taking things out from sort of local and national level. I've described some of that work that can be done at veterinary practice level and at farm level, taking that up to BVA level. And I've had the opportunity to chair the FVE, the Federation of Veterinarians of Europe, Food Safety and Sustainability Working Group that produced the document that you can see there on the right-hand side. So vets commit to sustainable food systems. And some of the infographics that we use then in and around that, around antimicrobial resistance, around One Health, circular economy, and so on. So very much thinking about sustainability in that broader sense and how vets can work with other stakeholders to do that. Just a wee plug again, and there's a link there to the British Cattle Veterinary Association, again, to reach farm vets. This contains some really nice information that allows farm vets to articulate things around the global warming potential of carbon dioxide and methane that are emitted from ruminants. So there's some really nice material in there about GWP 100 and GWP star. So again, that's available from the BCVA website, which might be useful for some people as well, sort of thinking about One Health approaches when it comes to agricultural production of livestock. The IPCC report's an interesting one. It's quite often used to bash farmers because some of the headlines are about carbon dioxide and methane emissions. And it's certainly an awful lot easier to measure emissions from ruminant livestock than it is to think about the sequestration of the pasture land that the livestock are actually living on. But the IPCC report contains some really interesting stuff around the benefits of livestock in terms of biodiversity, and how, although yes, they emit, they are emitters of carbon dioxide and methane, actually the biodiversity aspects of livestock in the countryside is a really important part of sustainability in the longer term, and mitigating against some of the effects of climate change, rather than just growing sort of monocultures. And obviously a huge amount of interest in regenerative agriculture at the minute, where people are looking at mixed swards that might contain things like chicory, which can help to reduce antimicrobial, reduce anthelmintic usage, just as a sort of natural adjunct. Climate smart agriculture, reducing the greenhouse gases, increasing agricultural productivity. And this isn't just about sustainable intensification, but this is very much about looking at where improving health and improving welfare can actually have a really positive benefit to agricultural productivity as well. And that gives farmers then the opportunity to look at other aspects of sustainability too, and enhancing resilience in agricultural systems. A good example of that is probably if you go back 20 years, we weren't really dealing with arboviruses. We weren't necessarily dealing in the UK an awful lot with insect-borne viruses, but we subsequently, because of climate change, we've dealt with an incursion of blue tongue into the UK, and we've dealt with Schmallenberg, and both of those are obviously transmitted by biting midges. The biting midges were there before, but they are now more competent in transmission of some of those livestock viruses. So we're building in some resilience when it comes to climate change, and that's sometimes about early diagnostics. It's about development and deployment of vaccines and so on as well. So this is kind of my last sort of substantive slide, and I just wanted to come back to this piece around funding and investing in innovation. Again, as vets or indeed as farmers, we cannot do this by ourselves. There are really clever engineers who are developing Fitbits for cows, sort of wearable devices that can give us a lot of information, maybe about early onset of lameness or early onset of mastitis, or improving fertility parameters that will help reduce, improve productivity. We're looking then at new formulations of drugs to improve compliance. Robotic milking parlors, we've got people who are specialists in robotics, we've got engineers, we've got diagnosticians who are, a lot of these robotic milking parlors contain inline conductivity meters, which will allow early diagnosis of a cow with mastitis. We're looking at feed additives, so the use of probiotics, prebiotics, proteobiotics, symbiotics in feed additives to help reduce the need for any oral treatments with antibiotics and anthelmintics. Antimicrobial peptides, and as I say, things like rapid diagnostics, so using mass spec and omics technologies, and some of these handheld devices now that are appearing as Penside, or at least at vet practice level, to allow more rapid diagnosis and better early onset treatment where that's needed. So that's a bit of a glimpse. It's a bit of a sort of fly through some of the agricultural aspects of One Health. I hope that's been useful for everyone. And but yeah, get beyond thinking of people, animals, and the shared environment, and think more about One Health being about communication, collaboration, and thanks for listening this evening.
Thanks so much, Simon, and to all of the rest of the panel as well for their presentations. That's been absolutely fantastic. We've really benefited from learning about their real experience that they've had in practical settings with dealing with a very wide range of issues in relation to this evening's topic, and their experience has been invaluable. So thank you for your presentations, and also for keeping it to 20 minutes as well when you're so passionate about something. I know that's a real challenge, and possibly the biggest challenge of this evening. You know your subject so well, but asking you to condense that down into a 20-minute presentation was a bit of an ask, and I know you've had to work quite hard on it, so that's very much appreciated. Just to reiterate, there should be, for everybody that's watching, a questions box on your screen. So if you have any queries for the panel to answer, or any comments even, please pop them into the questions box there, and I will feed them into the panel. But yeah, certainly some interesting observations, and perhaps some questions from me as well. I've been sitting here with my notes, and also looking at some of the resources as well that you've kindly provided for us. So not only can we benefit from your experience, but the things that you have access to yourselves and have been good enough to share with us. And from you know, Helen's point about the Royal College of Nursing, you know, I think there's a lot to be gained from that. You know, we've come a long way in veterinary nursing from, you know, just the basic use of nursing plans, which was, you know, when I was a girl and started nursing a long time ago, we kind of did that in our head, but to formalise it was great. And then to see how far that's come along, and for veterinary nurses to be able to access those resources is brilliant. One of my key takeaways from Fergus's talk, I think, was around the threat of us potentially losing antibiotics. You know, this is such a key thing, and we were talking just before the webinar started about, you know, real cases where, especially in Helen's experience, and in Simon's as well, where people really have very little choice. You know, they are immunocompromised, and we are limited in what we can treat them with. And Simon's key points about communication, and the resources that are available around, you know, large animal work and environmental issues and sustainability as well. So thank you so much for raising all of those things. And I never knew that cows could get Fitbits either. You know, I knew that there were automated systems for cows, but just that level of monitoring, maybe I should think about those for my children as well. It could be something to bear in mind for the future. I think one of the questions which is quite interesting is perhaps to Helen first of all, and then maybe to our vets. The use of testing for treatment, you know, these kind of informed decisions, how much is that used in the NHS, would you say?
So you're talking about the kind of point of care type things?
And in more general terms as well. So, you know, when we're talking about making informed decisions, is that based on, you know, a diagnostic result, or is it more about, you know, perhaps what Fergus touched on, which is a wait and see approach?
I think it's quite difficult. So as you've touched on, we were talking before the presentation. So the transplant patients that I've worked with historically, you know, are a really vulnerable group of people, and you have to make sure that what you're prescribing is relevant, and that links into, you know, what Fergus was saying about that really responsible prescribing and making sure that you are getting the right antibiotic, and you know it's susceptible, and you know it's linked through to what you're seeing. And I mean, I have always experienced, you know, really kind of high level practice when it comes to that within the NHS. You know, and even on a very, and also what I've really enjoyed is a real engagement with the nurses on this, you know, particularly in the ITU, and in transplant medicine, where, you know, automatic stop dates, for example, on computerized systems, so that, you know, if these drugs are, you know, are they still going? Why is this still going? Because actually the course should have finished a day ago. Those sorts of things, encouraging the nursing team to come up and say, actually, we should have stopped this, you know, why is it still going? Or, you know, those sorts of things. So I've witnessed really, really responsible kind of prescribing throughout the hospitals I've worked that are, yes, definitely kind of associated with, you know, really responsible diagnosis.
Hey, Fergus or Simon, would you have anything else to add to that?
I do agree. I think lots of cases benefit greatly from appropriate selection of diagnostic tests, but we need to remember that the test has to be aligned to important clinical questions. If you run fecal cultures, typically, well, in canine medicine at least, they very rarely afford you useful information. There are going to be bacteria there, and they're not essentially, or not often, the cause of the clinical signs that worry you. So you have to select wisely. If you're doing urinalysis, collect it from the bladder, don't collect it from the consult floor, because again, there's bacteria there and no one needs to treat that. However resistant or worrying it might seem, it's not come from the patient and it doesn't need to be treated. So I think we're lucky that there are more and more tests available, and we just have to make sure we're asking the right questions of those machines so that we can then use that information to guide our decision making. And rubbish in, rubbish out. So if you ask the wrong questions, you won't be able to get the right answers. If you've got sensible questions, diagnostic testing is key to optimizing your treatment strategy. Well, certainly for me.
Look, I think Fergus has really hit the nail on the head there. You know, it's about, I know it sounds kind of a bit sort of daft, but it is about asking the right question. And you know, if you ask the wrong question, you'll get the wrong answer, and you'll not be any further on. I think, you know, the holy grail obviously would be some kind of device which will allow us to make a really robust decision on whether or not we need to treat with antibiotics, and which one as rapidly as possible. Because at the minute, we're still relying an awful lot on culture and sensitivity. Now, it then comes down to asking the question, so am I going to wait 4 days before I start antibiotic treatment, or am I going to start something, you know, now? In which case, you know, you sometimes get a lot of farmers who'll ask me, well, what's the point in taking the sample then? You know, if we're already starting antibiotics, we'll either know whether it's working 4 days down the line or not. Why are we sending this into the lab and paying for diagnostic tests for it to be done? The thing I always would tell them is, well, that's fine maybe for this animal, but actually if we send something in and get some results back, it might give us a bit more information if another animal becomes ill. And you know, and that allows us then to build up more of a profile of what's actually happening on the farm, rather than just constantly looking for you know, the antibiotics. Because if we find actually that in the first animal, you know, it wasn't really bacterial, there was maybe a more of a viral component to it, then when it comes to the second animal being ill, you know, we know to go straight for the non-steroidal anti-inflammatory drug rather than reach for a bottle of antibiotics that the animal doesn't need. So it helps us to refine even in that kind of way where there is a delay. But like, there's some really good tests coming on the market now for, you know, with sort of fairly rapid PCRs for, you know, for mastitis, you know, which help to target the treatment there. We're seeing sort of biomarker assays becoming available, which again help to give us more of an indication as to whether something's bacterial or viral, and therefore whether antibiotics are appropriate or not. So yeah, I mean, some of those rapid tests now are really becoming more refined, and I suppose along with that, again, sort of thinking about the One Health approach, it's not necessarily the diagnostic test per se, but it's quite often the data that's linked to that, and how big data is interpreted by smart algorithms and machine learning that's helping decision making to become a lot more refined. And therefore allows treatment to be a lot more refined as well.
Okay, that's brilliant. Thank you all. And just actually, my next point was around the data as well. So Fergus shared with us as part of his presentation. He said some slightly crude statistics around you know, how you might measure antimicrobial usage. But of course, if we want to think about reducing usage, we need to know where we're starting from. So Fergus, you mentioned about, you know, literally quantities of antimicrobials per vet. Is there anything else that you could suggest where if any setting wants to look at reducing their usage, where's a good place to start?
Well, there are some tools. RCVS Knowledge have launched an audit device, and so that can do it. There used to be MySavsNet AMR, so there are ways you can do it, and often these are relying on percentage of consultations where antimicrobials are prescribed, and that may change because you may suddenly have a bacterial pandemic, that means that you need to give antibiotics more frequently. But if you assume that your caseload is fairly regular, then hopefully over time we could look to drive down antibiotic use. I think one of the questions that is really hard to measure is appropriate antibiotic use. And that would be fantastic if we could work out a way to say, I've used this amount of antibiotic and this percentage of it was dead set necessary to help those animals. And I think that probably there is a big gap between those total use and appropriate use measures. And if we could bring the total use down to the appropriate use, then we'd be where we need to be. That's really
sure.
Yeah,
so we're looking
no one
at
knows how to measure them.
Quality as well as quantity. I guess we need to, again, these things aren't necessarily simple to do, but it's all about the evidence, isn't it, and how we start with that and how we finish with it as well. Helen, have you had experience of monitoring in the NHS of usage?
Do you know, I was just trying to think. It's a really difficult one, isn't it? Because essentially what you're looking for is that, you know, it worked and it was appropriate, I suppose. And of course, then what happens is if it worked and it was appropriate, the patients go away, and that's usually a fairly positive thing, I would say, with the greatest sort of respect. There's respect there. So no, I mean, off the top of my head, I can't think of any monitoring that goes on in that way, but it's certainly something I'm going to have a look at now. It's one of those things that, like Simon says, you know, you learn everything you come to when it's One Health.
Yeah, certainly on the farm animal side, like there's some really good toolkits out there now. It started, I suppose, the pig sector was probably ahead of the game. AHDB were very involved in creating the e-medicines book, which is a tool. And what we were doing was trying to get away from using sales data, so antibiotic sales data, as a proxy for use. But of course, we know that not all antibiotics that are sold actually end up in animals. And what we also don't know is what age groups of animals that they end up in, or what types of animals, or what they've been given for. Okay, so you know, if you're looking at oxytetracycline, has it been given because an animal had a sore foot, or has it been given because it had some kind of wound, or has it been given because there was no vaccine available, and you know, you had a storm of abortions and you were having to treat everything with the oxytet? What we're now trying to do is to get that down into that individual animal level data, so we've got that granularity. If we're seeing a lot of antibiotic usage for treating sore feet, then maybe actually what we want to do to reduce and refine that usage in the next year is to improve our foot trimming and use foot baths. If we're using X amount of antibiotics for dairy cow mastitis, then do we want to do something in terms of our pre-dipping or post-dipping in the milking parlour, or something about our hygiene in the cubicle house that the cows are lying in? So it's looking and understanding, you know, digging in a little bit more around antibiotic usage, and yeah, ultimately then, you know, but you have to measure it in order to then benchmark and set a target. But you have to measure it in the first place. And again, it comes back to what Fergus was saying. It's about asking the right questions.
Yeah, sure. And I think it perhaps comes back to as well, not just about auditing your antibiotic usage, but about all of your practices as well, you know. So Fergus has touched on the use of antibiotics, you know, prophylactically for surgery cases, and also when you're looking at large animals, you know, are you seeing a lot of foot issues? Are you seeing a lot of wound issues? So are you seeing a lot of post-op infections, whether you've used antibiotics or not? And I know certainly in the NHS, the auditing is, you know, is part and parcel of everyday work. In veterinary practice, you know, it seems to be more of an opt-in. Perhaps if you're part of one of the things like the practice standards scheme, you'll be encouraged to do that. In other practices, you might not see it so much, but it's certainly a very good place to start, you know, doing your regular audits, whether that's monthly, quarterly, annually. And again, this comes back to the measurement, doesn't it? What are you seeing? Why are you seeing it? And what are you doing about it? I'm conscious of the time because we've run over very slightly. So I want to thank you all very much for your time again. I don't think we've got any other questions that have come in. Were there any closing points that any of you wanted to make before we sign off for the night?
Just one more wee point for me, just really in relation, I know we focused a bit on antimicrobial usage, but I think one of the really important kind of One Health interactions that's taking place across human medicine and veterinary medicine now is the involvement of social scientists in what we're doing. So understanding why we want antibiotics when we go to the doctor, why people want antibiotics from the vet when they go to the vet, and once we get to some of those tools that Fergus was talking about, the animations, the posters, the campaigns, to try and explain that. But social scientists now are really important, working alongside us in understanding how to drive and encourage some of that behavior change in a positive way that really matters. So again, it's just another one of those kind of examples of where cross-disciplinary collaboration can really make a difference.
Helen, Fergus, anything else from you? Sorry.
Well, the only thing I would say, just sort of leading on from Simon's point, is if it crosses your mind at any point, to think, oh, I wonder what they're doing in medicine, I wonder what they're doing there, send the email, make the call. It might be that the first time you don't get a reply, it might be the second time, or it might be it's sent to somewhere else, so you might get ignored. But actually there are people in the NHS and the people out there who are interested in trying to get these sorts of things going and are looking for connections. So if it crosses your mind, send the contact.
Absolutely. I think that we've got a lot to learn from each other, and there's no need to invent the wheel twice. We can build from each other's successes, and hopefully then we're all working to the same goal. So I think it's improved health, improved welfare. We can achieve it. We just need to take the best from both worlds, really, or all worlds.
Absolutely. Well, it's the whole thing together, isn't it? And I think we've really seen that this evening, that whilst we kind of divided One Health up into three sections, we can see how they all very much intersect and they're all co-reliant on each other. And I think we've had some absolutely fantastic pointers, for One Health champions in practice, that people can go away and take action. Literally, as we said, tomorrow morning when they wake up, what can they do? And I think that communication within practices, more communication to patients, if they're human patients, and to clients of veterinary practices, that cohesive approach will help. And the way that we communicate that, we were talking about this nudge theory, weren't we? That every single little thing that you do can contribute to actions and to understanding as well, which is a key thing and will help to reduce the kind of resistance that we see from people to accepting that we need to reduce antimicrobial use and protect these things as well, for all of us. So having a champion or more than one champion in any setting will only be beneficial. So if in a practice you've got a nurse champion and a vet champion or a management champion who are all contributing to this, there are things there that we can take away for, I think, every single setting for this evening. So just reminds me to thank you again for giving up your time, for making your presentations, and for answering the questions as well. Also, a quick thank you to the HORIBA team in the background who make all of this work, the marketing team who publicise it, and our technical team as well. We couldn't manage it without them. So a huge thank you from me to everybody. If you have any queries, you can forward them either to the HORIBA email address, and our speakers I know are very open to queries, so you can contact them individually via business social media or via HORIBA, and they have such passion for their subjects. I'm sure they'll be very happy to help you. We're exhibiting at BEVA in September and at London Vet Show in November, so if you'd like to come and see any of the HORIBA equipment, please come and see us on the stand. And I think that just leaves for me to close. Wish everybody a pleasant rest of their evening and stay safe. Thank you all very much indeed. Good night.